This is the One Thing Podcast, and I'm your host, Dr. Adam Rindy. The One Thing Podcast brings together leaders in functional and naturopathic medicine to discuss actionable information that may unlock puzzles in the areas of gut health, brain health, metabolism, and longevity. Please note, these episodes do not replace the opinion of your doctor. They are not intended to diagnose or treat any condition. Please discuss this information with your provider and discuss your own unique personal health history before adapting this information. Please subscribe to our episodes so that you can stay on top of the most current information in these areas of medicine.
Where do I start? How many times do we ask ourselves that question? Where do I even start this podcast? When you arrive to a scene of a disaster and you have an explanation of what happened, where the problem originates, where the problem became untangled, then you know exactly where to start. You just go to the area of disruption or the area of the disaster and you start cleaning up the mess. And over time, with a brief amount of investigation, you might find out that an oil tanker spilled or there was a fire related to the cause of the disaster. Well, there are people who are dealing with health problems where their body is acting in a way that feels like a disaster with no explanation. So day-to-day experience is that there's dysregulation, unpredictability, chaos in the body, and there's no known explanation. Think about the disruption that does to one's nervous system to have no sense of security, safety, explanation, closure with what's going on with one's body. The population of patients who are dealing with conditions like postural orthostatic tachycardia syndrome, mast cell activation syndrome and disorders, and also hypermobility, Ehlers-Danlos syndrome. These are people who are dealing with this experience on a daily basis. And of course, there's been solutions offered and treatments and suggestions that have helped them feel more stable, but often they still don't know why this is happening, what is the underlying reason, what's the root cause, what's going to make it flare, what's going to make it worse, what's going to make it better. This disrupts the nervous system to a degree that is an experience of unpredictability, an experience of danger, an experience of not knowing what's coming next. And this is the theme of this podcast. Where do we start? Well, I've been following this world of these disorders for a while now, and if you're a longtime listener of this podcast, you know that there's been several episodes related to these conditions. And I've often wondered, when a patient that I work with is dealing with these conditions, is where should I start? Until I came across Amber Walker's work, I didn't have the clarity to realize how important it is to consider starting with the nervous system in these disorders and stabilizing the nervous system. Oftentimes, this is a later conversation in the journey, and patients are turned towards limbic system balancing and vagal nerve balancing later on in their journey. I wanted to welcome on a guest who really puts nervous system balancing in the forefront of her work. This is a doctor of physical therapy, Amber Walker, who's written 2 gifts for all of us, for patients and practitioners alike. Amber is the author of Mast Cells United, a holistic approach to mast cell activation syndrome, that was published in 2019. She is also the author of the Trifecta Passport: Tools for Mast Cell Activation Syndrome, Postural Orthostatic Tachycardia Syndrome, and Ehlers-Danlos Syndrome. Her 2022 course, Conquering SIRS, is focused on healing from mold exposure. Amber has an amazing journey in this space, personally and professionally. And if you've read her books or followed her work, you can know that she is truly someone who has lived and practiced a way to help people heal from these disorders. I reached out to her because she really has a strong handle on stabilization of the nervous system and stabilization of these conditions. And I wanted to get her unique insight and flow when it comes to understanding how to approach neurostabilization. We had a delightful conversation, and we are devoting this conversation to a charity that Amber feels passionate about called Project Mercy. And stay tuned for more information about Project Mercy, and then we'll start the podcast in session. Thank you so much again for tuning in to the One Thing podcast. This episode is dedicated to Project Mercy. You can find their work at projectmercy.org. Project Mercy is an organization that Amber is very passionate about due to her work in Ethiopia. Their focus is on providing education, healthcare, food security, adult skills, and infrastructure in Ethiopia. We will donate $1 for the first 100 plays of this podcast and contribute it in Amber's honor. If you feel like contributing as well, just go to projectmercy.org and make a donation online. Thank you so much and enjoy today's podcast. Amber, thank you for joining me today. Welcome to the One Thing podcast.
Hi, thank you. It's a pleasure to be here. I appreciate it.
Yes. It's great getting to know you a little bit more offline. Of course, you've been so generous in sharing your journey through some of the books that you've written. And I felt like I knew you before even getting on the call with you. So it's just great to get to know you further. I'd love to just start off hearing about your life today. Your journey with your life and your health has been well documented, and you write about it so eloquently in your books. I'd love just to kind of hear today, kind of compare now what your life is like today and what you're up to on a daily basis to previously.
Yeah, absolutely. Well, I'll try to be concise about this because I could definitely ramble. But I've been very blessed to have this kind of full circle journey. And I think a lot of people can relate to this in their health experiences where you start out kind of ignoring a bunch of symptoms or pushing through, right? You're just kind of like in survival and pushing until the point where they're screaming at you. And then you become in this state of hypervigilance and reactivity and kind of rock bottom place. And then thankfully I've been able to heal, and I feel like I'm in a great place of balance now. My story had a lot of labels and diagnoses. I think probably when I was in my 30s is when I really hit that rock bottom place. But I always kind of had weird health stuff going on growing up. But really when I hit rock bottom, I couldn't work or function very well. I actually moved back in with my parents, underwent a bunch of different IV therapies and different treatments, medical treatments for various things that were going on. And the, mast cell activation syndrome, or MCAS, was a part of it. POTS, or dysautonomia. I had the hypermobility spectrum issues, the HEDS issues, a bunch of other diagnoses. Hereditary angioedema was part of it. I actually had some parathyroid tumors removed at one point, had Lyme and co-infection issues and all sorts of gut things, parasites and SIBO and celiac. And, the list goes on. It was like this resume that you don't really want to have of illnesses once you finally start to learn what's going on in your system, the chronic viral, bacterial issues, intracranial pressure issues, CSF leak. I was having a lot of anaphylaxis on the regular. I I had a bunch of misdiagnoses too, and I hear this a lot in my clients, a lot of autoimmune diseases that were misdiagnosed. So things like they were looking at MS for a while, rheumatoid arthritis and Crohn's disease, and a plethora of fractures. I think I counted about 20 fractures I'd had over 15 years or so. So bone issues as well. But basically coming out of all of that, and it took several years, it's never overnight, but with the help of some functional minded practitioners in my own research, I was able to really go from that survival mode to thriving again. And I'm just so grateful that it's come full circle and then I'm able to work again. And I actually live abroad now. I go surfing every single day. I'm very physically active and just feel that balance and that groundedness on a daily basis. And so I'm just very grateful that I am where I am and that I've been able to reverse, so much of this and come back to just this place. I think one of the things that I didn't really talk about in the books, because this has been an ongoing process since they were published, is also the degree of nervous system work and trauma work and work on things like boundaries, emotional healing that's happened in my life. I think in the last couple of years, even just since moving to Mexico, I've been really lucky that I've seen a lot of progress and continued healing even beyond where I was. So I think that it's a journey, it's a process, it's never overnight, but I'm grateful to be back to where I am today.
Yeah, I'm curious when you listed all the different, I guess, labels or assessments or diagnoses that you've had, and then all the different treatments you've been through. We paint this picture as practitioners of this journey of peeling an onion, and sort of like it's this sort of really circular, uniform process of getting to the root cause, but in all actuality, that the process of getting to a place where you're stable and better and healed is not as uniform. I'm curious if you were to reorganize the process of, kind of your discovery of like looking at what are the root causes, compared to where you did start and where you would start today in that process. How would you organize it today, knowing what you know now, as far as like in this world of mast cell related disorders, where would you start now, knowing what you know?
Yeah, that is a great question. Well, I think I would change the order and the focus of things quite a bit in my own journey now, kind of knowing what I know now. I think originally I did spend quite a bit of time on the mast cell piece, which is not that it's unimportant to stabilize mast cells or to focus on that. But I think, ironically, yes, I did write a few books on the topic, but zooming out and stepping back as I have, especially these last few years, and looking much beyond the mast cell, because I think it goes much deeper than that. I think in my case, I really kind of hit like very specific. I sort of like did spot treatment of very specific things, whether that was something for SIBO or whether I was, doing a bunch of intensive treatment for Lyme disease. I did a lot of things that were kind of segmented. And now I think I would go back and probably bring in an overall focus on opening up detox and drainage pathways earlier on. The mold piece was huge for me. So that was big. But one of the things I also have learned through my own journey, as well as working with clients, is that the nervous system work, I kind of put that at the end of my own journey. I was kind of undervalued that to an extent. And it wasn't until I got deeper into that work that I realized how important that is as a baseline that everyone needs to have at the beginning from the get-go. Because if your nervous system isn't balanced and regulated, it's going to be hard for your body to give itself permission to detoxify and to focus on these other functions. It's going to be in that survival mode, and it's not going to be as effective. So,
yeah, and I think that's one of the things that really drew me to your work is just how much your professional training prepared you for knowledge in this area, and then just how you've applied your knowledge about the nervous system to your own health and for your clients. I would just be curious if with the nervous system, if we could sort of unpack this interface just from a big picture standpoint between the vagus nerve and this immune activation and some of the other core imbalances we're seeing in this population that you're caring for.
Yeah, absolutely. That's kind of a loaded question, but I think it's there's a lot of overlap in these conditions, and talk about the trifecta: MCAS, POTS or dysautonomia, and HEDS or hypermobility spectrum disorders, depending on who you're talking to. But then it's easy to. There's a lot of overlap, I think, with neural factors and with kind of the functional medicine and toxic burden angle that connect all of these pieces and explain it a little bit. But I think, if we look at on a cellular level, our mast cells are part of this immune watchdog system, and they're really trying to help keep our body in that homeostasis, but also recognize if a foreign invader is threatening us or something like that. Then we have kind of the more central mechanisms with our brain and even the hypothalamus, and how that's kind of that master switchboard that's constantly scanning and checking things and helping tell different organs to release hormones and chemicals in response to what's going on with that kind of thermostat, so to speak. And that definitely regulates our autonomic nervous system responses as well. So there's a lot of overlap in these different on a cellular level, what's going on, and creating this sort of perfect storm of issues that can happen with people with this. But I think even zooming out systemically is really important here, and looking at kind of, I keep coming back to that toxic burden with people, because I think that is so important in what happens with our autonomic nervous system regulation, and looking at, things that people are exposed to in utero, coming out like from the get-go, already having things, a lot of these clients I work with had things as infants and as young children and beyond. In the world we live in, standard American diet, if that applies, all the toxins that we're exposed to, it's certainly easy to get overwhelmed learning about all of that stuff. But I do think it is relevant. And I do think that is the common denominator for a lot of these patients who have these different labels or clusters of conditions that is kind of the glue holding it all together. So it's really important to use that root issue approach to help people take down that systemic inflammation, but at the same time do the nervous system work, because the limbic activation has shifted in response to these triggers.
Yeah, it makes sense, because if you think about just like a basic term like danger, right? And that the body is equipped to respond to danger. And if there is these new contaminants or toxins or environmental triggers that for the first time in years and years and years, our children and our communities are being exposed to more and more environmental exposures, that the immune system would have a heightened danger response. And in some people, the same two different people could have two different responses to those dangers. And in some people, it's just a very heightened response. So it makes sense that you've kind of zeroed in on that, because it's like that's such a physical example of what our population is exposed to now that may have not been exposed to hundreds of years ago.
Yeah, absolutely. And I think people are always wondering too, how does collagen get impacted, or what does HEDS have to do within all of this, right? How does that piece, because it's a little bit easier to understand the connections with the mast cell piece and dysautonomia and what's going on there. But I think too, again, if we come back to that toxic burden concept within the collagen, even we look at something like glycine versus glyphosate, and how glyphosate mimics glycine and actually impacts the collagen and triggers that almost auto-inflammatory response, as an example of a toxin that has a direct impact on our connective tissue. And our collagen is part of that extracellular matrix, that kind of that space between everything, where a lot of communications occur and a lot of important functions occur. So I think that, again, I keep coming back to that with people, and is just this common denominator, and that we really have to address that terrain, whether it's the biofilm, we really have to address that terrain to help people heal. And I think that's very, very important.
Yeah. And it's so if we can sort of look at the nervous system in a sense that, it's at its core, a sensory organ, processing the environment and helping us navigate, make decisions, and communicate. So I like how you've talked over the years about how to organize this system, looking at the different branches of the vagus nerve, and some of Porge's work that's influenced your practice. Can you kind of set that up for us so that we can kind of get more of a sense of like how the sensory organ might be reacting to some of these triggers and what that downstream effect might look like?
Yeah, absolutely. And I think there are some great resources, first of all, on this topic. I'm not the generator of any of this. I highly recommend people learn about the polyvagal theory by Dr. Stephen Porges, and Deb Dana has some great books out there as well on that topic that does a deeper dive into it. I think, first of all, if we zoom out even away from the vagus nerve, we have these 5 cranial nerves of social engagement. So I think for a lot of people, it is more than just the vagus nerve when it comes to this neural work. So we have cranial nerves 5 and 7, 9, 10, and 11. Those are kind of the 5 cranial nerves of social engagement. And they impact all sorts of things and sort of have this interwoven communication, so to speak. And so it's important to keep that in mind if you are going to be doing any neural work with people, that it can go actually quite a bit deeper than the vagus nerve. But the vagus nerve is a big different one, right? So it basically goes from the brain to the gut with various branches along the way. And there's this front or ventral branch and this dorsal branch of the vagus nerve, and different functions and pathways sort of light up depending on what's going on with the system. But with the vagus nerve, it's believed that there's 3 kind of mechanisms that influence it, so to speak, in the body and influence our neural regulation at the same time. And so top-down mechanisms would be something that stem more anatomically from something closer to the brain or the cervical spine. So we could have some compression or inflammation on the vagus nerve from something like craniocervical instability. So issues with C1 and C2, for example. Chiari malformation is another one. Even that kind of intracranial pressure balance, extracellular fluid leaks, those seem to impact quite a bit. People have had a history of concussion. A lot of my clients, kind of omit that from their history, where they forget, like, oh yeah, I did have either a traumatic brain injury or concussion way back in the day. That also seems to play a big role in our vagus nerve. And then, so that's kind of the top-down way that we can see some physiological shifts in the function of that nerve. Then we also have the bottom-up concept. So where kind of the sensory nerve fibers in the gut are, we could also have a bottom-up assault, so to speak, where we have SIBO or leaky gut going on, or some kind of other inflammatory process in the gut, even overactive mast cell stuff going on in the gut. Autoimmune type conditions are all considered to be part of that sort of bottom-up assault on the vagus nerve. And then there could also be more of a kind of full body assault of it, where that's kind of more of a systemic level. Motor type neuritis is what they talk about, that one with the literature, where things like neurotoxins, heavy metals, the presence of something like Lyme or co-infections, those can all have that more systemic influence on that nerve as well. So for most people, honestly, we don't spend a ton of time teasing out which is the main driver, because they typically have sort of this perfect storm and they have various angles of this vagus nerve assault, so to speak, occurring at once. And so I think that it's definitely important to work on those root issues and to try and reduce systemic inflammation, again, from more of that functional medicine lens. But then we also want to come up with a program to help the whole autonomic nervous system and these other cranial nerves of social engagement just sort of re-regulate and heal.
Mm-hmm. Yeah, and I think, most people who are sort of diagnosed with these types of imbalances, the medications offered don't generally sort of address vagal tone. It's sort of downstream patches and symptom control.
Absolutely.
Is it just that? I don't want to answer my own question because I kind of know the answer, but I want to ask you a question I don't know the answer of. Is it problematic to just start up with vagus nerve approaches and vagal nerve tone when someone's in this more dismantled state of inflammation and dysregulation, is it problematic, or is it just sort of safe and effective?
Mm-hmm. That's a great question. I think I see a lot of people who come to me and go, oh, I already went there and did that. I tried that. It went horribly. Or I tried, there's some really wonderful programs out there on the internet, for example, that are sort of follow along, whether they're DVDs or videos or something, that teach you some exercises and some things to try. I'm not against those programs, but I think for individuals who have been chronically unwell for a while and or who might have a trauma history, that they really want to work with somebody to have a customized approach that's trauma informed. Because a great example is a lot of people go, oh, like I've tried guided meditation or mindfulness and it actually triggers me. It makes me feel worse. Or I tried breath work and it really amps up my system. Like breath work does not help me. When in theory, those things should help regulate that system into more of that ventral vagal tone or that place of peace and joy and safety. So yeah, it's not this cookie cutter, there's these protocols or the concept of this, one size fits all does not work for this type of work in my experience. And it really does need to be customized. And I think it's really important you brought that up, because I think a lot of people just write it off because they had one bad experience too. And they're like, well, I already tried that stuff and it just doesn't work for me. And, I think working with somebody who is with you in real time to kind of gauge your history, what's worked for you in the past, some of the patterns, and to use that to come up with a plan that's customized to you is very, very important. So,
yeah. Yeah, I always like to approach these kind of physiologic and psychologic or kind of holistic imbalances with thinking about how to create safety, and I love how you point out in your book about when that vagus nerve is in tone. It's like this is when people are behaving as if they're safe and feeling safe. So there's better eye contact. Mm-hmm. The voice has a different tone to it. And if that's the vision to help people get back to their that kind of tone or to spend more time in that place, I think it's good, that we sort of, like you said, customize per each person where to start. So one of the things I've heard you talk about is that there are safer ways to enter vagal tone or to approach vagal tone than others. Can you share some of the things you do that you feel like for people maybe who have a trauma background or people who might get extremely triggered if, we start going into deeper nervous system disruptions? Where are some safer ways to start?
Yeah, I would say I kind of have a 4-part approach with this kind of work, typically when I'm working one-on-one with somebody. And I think, well, maybe even 5 if we count kind of the education at the beginning. So some people aren't familiar with the polyvagal theory, and sometimes we start with just identifying the different nervous states that can occur so people can engage in this concept of neuroception, or sort of this understanding of where they're at on this spectrum of nervous system responses that can occur. So even just breaking it down to the basics at first can be really helpful. And understanding not what this looks like in theory, but what does this look like in your body? Like, how does this manifest and show up with you and your physical symptoms, your emotional, mental health, et cetera? So kind of recognizing the ventral vagal tone, that desired zone of safety, but also what does that sympathetic chain activity look like for you? And most people are pretty familiar with what fight or flight looks like. I mean, it's pretty in your face and obvious when it's going on. But I think the more complicated one is when somebody's in that dorsal pathway, where they're more in that sort of frozen place. And sometimes it's not just, it's not super obvious, and people can be in freeze for a very long time without realizing it. And it might just be more of a state of indifference or lethargy or brain fog even, or some of these other physical ways it can manifest. I think a lot of times in the conversations I have with clients, they have aha moments, the light bulbs go off at the beginning about like, oh, that's what that is. And recognizing things that they're already doing subconsciously to help their system shift or try to get out of those zones a little bit. Looking at the existing toolbox. What are you already doing that's working? What's not working? And then from there, we can build a customized approach. And, I think it can feel pretty helpless if you're stuck in one of those zones or if you're continually dropping into fight or flight or freeze. But just helping people recognize when they're there without judgment associated with that, because it's easy to be hard on ourselves also, and to kind of step back and observe those patterns, but then to slowly explore exercises. Now, I really like to start kind of with a somatic approach to this more than a meditation mindfulness. And breath work is technically somatic, but I think those strategies for me, I don't see them work as powerfully as some really simple things. And the idea is to really come up with a toolbox in my work where people have not a million things of homework to try, but 2 or 3 things that they really like, that consistently work, that they can employ anywhere. So whether they're in public, whether they're at home, something that they can do for even like 20 seconds, 30 seconds to help regulate that ventral vagal tone a little bit better and shift the nervous system up that ladder. That can be really powerful. And I think sometimes people write this work off, or they think it sounds too simplistic. But if you slow down enough to really get into this process, it's amazing what can happen. And I think that starting out with a conscious approach and recognizing when you're shifting and doing something to counteract that or help ground the system is helpful. And over time, it becomes less of a conscious thing that you need to do, or less of an exercise, so to speak, as your body naturally will start to bring in those tools without you even thinking about it. But I think that can be a really helpful first step, that customized approach. And then I really like to utilize something called the Safe and Sound protocol. So this is an auditory program, and there's a couple different playlists or options to choose from, but essentially the one that's been studied the most, the core program, delivers different frequencies and tones embedded into music that you listen to. And it's about 5 hours of music spread out over several different sessions. And I find that to be very helpful for people in retraining the middle ear muscles as part of those 5 cranial nerves of social engagement. So we have our tensor tympani and our stapedius muscles. And when we've been through any sort of trauma, whether it's big T or little t trauma, whether, it's something that happened recently or a long time ago, a lot of times these middle ear muscles recalibrate and shift, and they make us more in tune with cues around us that put us in a hypervigilant state. So our ear muscles are straining to hear background noise because they want to keep us safe. They don't want us to get snuck up on. And so over time, obviously, like, the body means well in having these mechanisms, but over time that's detrimental to us because it's harder for us to engage in conversation with others and hear others, like difficulty hearing somebody talk in a crowded room. That alone could be a sign that maybe there's a little bit of dysregulation there. And so I like the SSP because it's not just the vagus nerve that it's working on, but it kind of expands a little bit more into those cranial nerves of social engagement to help the system get kind of the reset button in those areas so that it can rest in a place of safety. And like we talked about earlier, if you can rest more percentage of the day in a place of safety, we're not expecting perfection here. Nobody's going to be in vagal tone all day, every day.
Yeah.
If we step out on the street and a bus is coming and we need to move, we definitely want those systems to still be able to kick in. But as a whole, I think, starting to do that kind of work can be profoundly helpful for shifting the system to a place where then digestion gets better, sleep gets better. I have a lot of clients who their vision actually substantially improves through this auditory therapy. Just the body's ability to detoxify things as we start to do more functional medicine work is really enhanced. So when I first started this work, I, kind of like my own personal journey, I would talk to people about it and we'd eventually do it, but I didn't really push it up front as much. Now I really encourage it almost day one, because if we can get this foundation, this baseline, even if you're still living in mold, or even if you're still having some of these triggers around, if we can try to start this work, it really impacts I would say the rate of healing.
I love that. Yeah, I think as a practitioner, it used to be, and it's changing, that I knew when my patient was ready for the vagal nerve work that we had done a great job getting them to a good place. When they initiated that readiness, or when it became clear that they're ready. And now I'm realizing that it's, like you said, so important early on versus sort of waiting for this moment where the C parts for this deeper work. But I really also like that you have this other modality, like the Safe Sound protocol, because I think for so many people that have had nervous system dysregulation, whether it's, you can label it anxiety or trauma or complex trauma or PTSD, whatever you want to call it, that feeds into this vagal nerve dysfunction. For so many people, it's scary to even do exercises that make them feel better because they've lost the connection to their body.
Yes.
And that kind of brings up anxiety and sometimes it's good to have modalities that sort of just take the lead for you. And more kind of, they call them passive modalities, but I actually think they're more active modalities. Can you comment on that, if that's been your experience with people?
Yeah, absolutely. I think there's certain individuals who will feel sort of paradoxically triggered by signals of safety. And that's why this especially for those cases, customized, working with a practitioner who could recognize that and who can help. I've yet to find somebody who wouldn't tolerate any approach. There's always something that's going to help them feel safe without triggering reaction if we explore enough options. But it can be a little bit of trial and error, just as some of these things, like with the mast cell work, there's some trial and error to find the right fit. And so I think it requires patience on everyone's part. And again, that zooming out, that neuroception without judgment, not getting frustrated with yourself if like, oh, this makes me feel worse, but it helps everybody else. Like that kind of a mindset, it's really easy to fall into. It's easy to get frustrated with this. And so, yeah, it's very, very important to recognize that, that there's no, like I said, there's no one size fits all for this, and that it does have to be really customized. And I think you brought up a moment ago, kind of how you've thought in the past about when to integrate this and waiting for that moment. And I think there are certain cases where people are in such a toxic environment that this kind of work is much less effective. And so there are certain cases where I will go, okay, until you can breathe and that we can be in a little bit different space, I'm not going to integrate this. So I have had cases where people were in really moldy environments, for example, or maybe the toxin was coming from a human and there was some boundary work and some emotional healing that had to happen for that person to be able to start to do this work. That's all very relevant and important too. And that's something that, I like to refer out a lot for. I obviously, by nature, by training, don't have a ton of a background in terms of the mental health side of things, but it is important to have those conversations with somebody and to really have a trauma-informed practitioner who can help you work on your identity, because a lot of us have this identity with illness that goes deeper, and we need to do some work on that to let it go and to heal. We need to do work on boundaries, on relationships. It's amazing how much unhealthy relationships can impact our physical health. Even just that hypervigilance and that ability to shed layers, to release control, that's really powerful in this nervous system work. And so starting to have these conversations with somebody, it's got to be done with finesse, because I think a lot of clients have been gaslit for so long, and they have a lot of medical trauma that they're bringing to the table. And so it's really important to recognize that, to validate them and their lived experience. I think some people are really hesitant to do any nervous system work at all, even just the word nervous system. As you're talking to them, they immediately kind of push back, like you're implying that this is in their head, but it's the opposite.
Right.
It's that the body's physiological mechanisms are in this limbic kind of loop that's kind of stuck. And so it's very, very important to have those conversations so that clients or patients understand what's the goal here and what are we trying to say with all of this verbiage, right? So that they realize the importance of this. And energy work is really important. I mean, I think a lot of individuals who are dealing with these conditions are empathic in nature and are really influenced by their environment emotionally too. And so all of this kind of plays a role and is really important to work on. And I think also one of the other things I like to utilize is actually some desensitization programs and things you can do with tuning forks. So there's some other types of sensory modalities that you can utilize to help the body kind of shift and heal a little bit deeper on this neural level. And I think that's really important in all of this, and as well as helping people find their way back to something that really grounds them and brings them joy that has nothing to do with healing. So for me, that was surfing. I think just being on a surfboard, there's something healing about the ocean, about the energy, about water, about barefoot grounding as I'm walking into the ocean, all of that, right? It's like a seated meditation on a surfboard half the time, depending on the day. But I think that's one thing I also really like to work into these conversations with clients is what's your surfing? Like, what is that for you? And I think for people, it's almost hard at first to even go there because they have been homebound or really severely disabled for so long that it's hard to like let yourself dream and hope about those things again, or to bring anything into the daily routine that involves that. So yeah, it's obviously very complicated. There's a lot of angles that are important in this.
Yeah. When I think about surfing, like that is such the state of ultimate trust.
Yeah.
Kind of oneness with nature and oneness with yourself and the creator. And, it's like, I like that you try to find what the surfing is in their life, because, not everybody's going to go jump in the ocean, but we all have our own ocean where we feel that flow.
Exactly. I was just going to use the word flow. That's exactly it.
Yeah. I love that. That's such a powerful concept. And I don't want to give the impression, I think I've sort of given the impression that there's certain things that are not put in place in these early days or these kind of this destabilization process, because you're very clear that you're a big believer in stabilization therapies, and that people shouldn't just be struggling with all these symptoms of whether it's edema or blood pressure drops or palpitations or mast cell reactions and digestive issues. You really believe in like there are therapies out there that get those on board and get people stable while we're working on this other stuff. Is that right?
Absolutely. Yeah. I think a blend of both worlds is really important when we look at mainstream versus natural medicine, and that many people really need that first foundational level, whether that's medication induced or something else to heal. I mean, you look at POTS management, a lot of the advice out there is drinking tons of fluids, salt, compression socks, medications. I'm not against all that stuff by any means, especially if that can help people be upright more, moving a little bit more, because exercise influences how we detox. There's all these angles, right? So it's never black and white. I think the thing that is hard to watch is if people just do that, but they don't pursue any healing of the root issues. And that's, I think like the next phase or the next level is once things are a little bit more stable. So it's not just pushing through and no pain, no gain. It's really the opposite. It's being intuitive. It's honoring what your body's telling you, going at the pace that your body's telling you, even though it can be frustrating at times if you want to go a little faster. But that's the art of healing, right? So.
Yeah. I mean, I think it's also really clearly described in trauma work that there's phases of stabilization and phases of destabilization, and that we need to be intentional about those, because some people might go off to this conference and learn how to give like EMDR or something and come back and start giving these techniques or using these techniques on their clients or patients, and then they're destabilizing the system versus creating safety and creating trust and creating and really understanding the bigger pieces and the whole story, and getting your patient or helping your patient or client feel better, at least, and feel more stable. Then maybe do some destabilization work, which is more kind of that core work, and some of the harder stuff, more challenging stuff that's going to push a little bit on the body to heal. So I think it's so important, to have those two modes and be really intentional about when is the right time.
Yes, absolutely. And I think that's when you look at the exact same thing applies to detox work too, in terms of looking at even just the mold piece, and some practitioners who might just start throwing a ton of stuff at people without maybe looking at stepping back for a minute before you start to do a ton of binders or some of this other work, because I think a lot of people just go straight to that stuff and in the wrong dose, and then they have horrible experiences. And again, they kind of write that off as well, when if you kind of approach it with a gentle finesse and working at preparing the system to handle that, preparing the detox and drainage pathways a little bit more, and building rapport, like you talked about, building that trust up with that person and those things as well, that I'm not just going to throw a million supplements at you and hope for the best, which I think is a lot of people with MCAS, especially, they've gone to natural practitioners and had that experience and gotten frustrated because that person didn't kind of layer things and try things in maybe the manner that was better for their body. So I think that's very important, kind of that building up that trust in the process before going deeper, whether we're talking about nervous system work, whether we're talking about detox or anything else.
Yeah. Excellent. Yeah. I want to get something off my chest about this world that we're talking about. There's sort of this misconception, I think, in people who are dealing with whether it's the trifecta or kind of related issues, is that, that they're just, I don't know, it's almost like there's this misconception about how strong or how durable or resilient these folks are. Mm-hmm. And I just want to say, like, in my patient practice, like, I can see the faces of the people I've worked with. This is the strongest group of people I have ever dealt with. Most authentic, strongest, most vulnerable, just most willing to just dig in and do the work group of people that truly is inspirational to me. I just want to I know that you've been in this world personally and professionally, but I want to hear that from you as well, because I am always sharing, like, how with people that, this is kind of like the real ninjas of the world are we're talking about here.
Yeah, absolutely. I don't think I've ever met more resilient humans than I have in the last several years in this work. It's very humbling at time, and it's an interesting concept. But I've started to learn about myself and my own health, and in some of my clients as well, is that certain personality types more than others are going to be more that type A person that puts a lot of pressure on themselves, and that kind of goes through healing with their checklist and their spreadsheet and their all of the things that they want to try. And sometimes they're almost like pushing too hard and trying to do too much, and you kind of have to pull the reins back from them a little bit and go, we've got to slow this down a little bit. And so I think there's certainly different types of clients and how they approach healing. But I think it's with that type of a person, especially, it's important to help them lean on their own intuition, but also take a step back and work on that piece of surrendering a little bit and faith in the process. And that can be really challenging when somebody has been unwell for such a long time. So it's that resilience is a blessing and a curse in some ways, but finding a way to
exactly
recognize their own inner strength, showing them compassion, validating their lived experiences, and then also helping them do some of the, eventually as trust builds, some of that deeper work is all really important.
Yeah, I'm glad you balanced what I said more, because I want to add to that, because I think in Porges' work and some of the vagal work, there's this concept of fawning, where a fawning behavior is talked about as sort of a vagal imbalance behavior where we become people pleasers, and we want to love and be loved for the avoidance of pain or avoidance of rejection, or there's lots of ways to unpack it. But that's one of the things I think is really important. I'm glad that you balanced what I said, is that to help our patients have a place where they don't have to feel like they have to be perfect, and they can take off the mask and they can feel safe and loved and accepted, even if they're not feeling like being resilient, and they're not it's not about impressing the practitioner or being a good little patient or anything like that. It's about, like, let's get to the heart of the matter and support you and take away that kind of response to fawn. I encourage people to research and learn about the fawning behavior, because I think it's off people's radar.
Absolutely. Yeah. I think that's definitely a commonality I see with a lot of the people I work with. And that very much plays a role in this nervous system work and beyond. I think that's very important. And just helping that, coming back to the concept of like pushing through, powering through symptoms, then the hypervigilance, and then coming full circle to this balance. It's finding the balance, right? So I think it requires some surrendering and letting go of control to get to that point. And in a world where everything feels out of control, that can be very scary. And so it's really just meeting people where they are, and again, customizing it to their lived experiences and where they're at today.
Yeah. Yeah, and I think if anybody's listened to this and they're wondering, well, what's this have to do with histamine or have to do with cortisol or have to do with, with my gut? Well, everything. But I think learning, you really unpack that well in the 2 books that you've written, and I think it's so interrelated. The way the brain and gut interacts, the way the immune system and gut interacts, the way the histamine responds to cortisol and stress responses. So I think just understanding that in the context, you can always weave that in with learning further through your books. So I want to make sure that I stay on time with you here today, and I want to kind of leave the rest of our conversation just to kind of hear about some of the work that you're doing right now and ways people can get involved with learning from you or working with you. I did see you have 3 different options for people to work with you, and I'd just like to hear more about that.
Yeah, absolutely. Well, I am still offering one-on-one consultations. There is a bit of a wait for that, but that is an option, and there's information on my website about how to get set up as a new client there. I've recently started seeing people in person down here in Mexico. So if you are an individual who has the stability to travel, there is that option. There are a couple of things I really like to integrate that are just tough to do via telehealth. One of those is something called craniobiotic technique, which is the stimulation of these different neurovascular reflex points in the body. It is a muscle testing type technique that helps us determine what is the body trying to tell us or signal us is kind of the biggest root issue for all this inflammation. And so you can actually utilize different points on the head in conjunction with some of these torso points and the energetic balancing of things to help the body kind of lock into that and heal it without the need for as many supplements and things like that. So for a lot of my sensitive individuals, that hands-on technique can be really helpful, and it's not something that has to be repeated all the time, thankfully. So it's usually a week down here is pretty sufficient. We can get going on that type of work. So I encourage, if people are interested, there's also information on my website about that process. And then I'm going to be starting up some groups this year, which will be fun. So there'll be some virtual group options as well that'll be popping up there pretty soon. I'd really like to continue to try and educate and research and perhaps publish another book this year. We'll see if I manifest that one. But I also do have a course out. So for those listening who want to learn a little bit more about CIRS, which is that chronic inflammatory response syndrome from mold, that's one of my passion areas. So I do have a course out on mold and kind of healing from mold illness as well. That's another way to learn more. So.
Excellent. And just any kind of closing thoughts that you would like to leave us with?
Yeah, well, I think it's always good to zoom out. So if you find that you have tunnel vision on the mast cells or on one particular label or diagnosis you've been given, don't ignore that, but also I think zoom out a little bit and look at the whole big picture, because that'll help tremendously. I think we talked about so much already with the nervous system and just the importance of that, but starting there and not waiting, or starting there as soon as you can, as your system feels like it's in a somewhat stable baseline, can be really helpful. The importance of just opening up drainage and detox pathway first and working with a practitioner who can help you slowly work on the toxic burden, prioritizing biotoxins. I'm a big proponent of that for sure. And also maybe just kind of circling back to the importance of the inner work and the stuff I've discovered personally in the more last couple of years or so of the emotional healing and trauma, kind of some work on the trauma and boundaries and all of those things. It's when the way I look at it now, that might be way more powerful than any mast cell stabilizer, any toxin binder, or anything else we're doing on the functional side of things.
Wow.
That work is tremendously important and certainly needs to be guided with somebody who can help you with that in most cases. But I think that that's something that is not valued enough probably in this world. So, but the ultimate takeaway is, healing of these conditions is possible. Reversal of these symptoms is possible. I think a lot of people get triggered when they hear that for different reasons, or they don't like to hear that, or they want to blame a lot on genetics. But this environmental angle plays such a huge role in healing. And so I see it, every day that it is possible to reverse and to consider yourself like myself. That I don't have POTS anymore. I don't believe myself to have MCAS anymore. I rarely have a flare in hypermobility issues. So even the collagen stuff, I think once you lower that toxic burden and help the body start to heal in other ways, it can be very powerful for everything. So yes, please have a message of hope here, because it is very, very possible to go back to thriving in terms of addressing this area.
Thank you. Yeah, that's so wonderful. And I just want to emphasize to people that jumping into this world of naturopathic, functional, physical therapy, these therapies as soon as possible when you've been in this world, and not wait until, sort of desperation. And grabbing, hold of some of the information that Amber's written, I think is such a great guideline, because it's researched and it's solid and it comes from experience, versus, sort of pulling a bunch of different posts offline just to have like a really good solid foundation to start with. I'm just so grateful that you've done such good work, and we have a resource for people to start with, because they won't have to struggle as much as people in the past.
Thank you very much. I appreciate that. And I hope they are helpful resources.
Yeah. Yep. Excellent. Well, thank you for your time.
Yeah. Thank you so much, Adam. It's been great chatting with you.
Yeah. Same here. Take care.
Thank you so much for tuning into this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from that. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.